Hi, good afternoon, everyone. It's great to see you all today. It's been a while since we've had one of these calls. Typically, we'd be having our call the first Tuesday of the month, and we pushed it back a little bit this month because we had some scheduling issues and wanted to have more information to share with you all today. So appreciate people taking the time to join us. I'm Emily Beauregard. For those of you who don't know me, I'm the director of Kentucky Voices for Health, and I'm a member of the ThriveKY Campaign. It's also been a while since our last forum with the Cabinet for Health and Family Services. During the General Assembly, we had to skip one of our forums, and so we have a lot of updates to share with you all today, and really looking forward to getting some new information about many of the safety net programs that the Cabinet administers. On our call today, we have Deputy Secretary Carrie Banahan with us, Medicaid Senior Deputy Commissioner Veronica Judy Cecil, the Director of the Division of Family Support, Jason Dunn, the Department of Public Health Deputy Commissioner, Dr. Connie White, and Assistant Director of the Division of Behavioral Health, Dr. Patty Clark. So really appreciate the time you all are giving us this afternoon and the information that you are prepared to share with us. As always, our goal with these forums is to create more open dialogue between the Cabinet leadership, consumers, and advocates. We really want these forums to be useful to you and to the work that you do in your communities. So we try to make sure that we get the latest information on the state's response to COVID-19, opportunities for any ways that we can be of assistance in getting out information, updates on safety net programs, and then also sharing feedback, hearing and answering your questions. So please make sure to use the chat. And I know that most of you are familiar with Thrive Kentucky now. Kelly, why don't we move to the next slide? But for those of you who might be joining us for the first time, our core purpose is to meet the basic needs of every Kentuckian through systemic change. And we focus on this because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. And for that reason, we believe that the only way that every Kentuckian can thrive is if we are working on systemic change, and specifically through policy change that is anti-racist and anti-poverty, that will lead to a more just and equitable Commonwealth for everyone. You can see our shared principles on this slide, and then our members of the steering committee on this slide. And all of those links, I believe, go to their websites if you want to learn more information about any of our organizations. We can go to the next slide, Kelly. Also wanted to say thank you to our growing list of 2022 Thrive Kentucky sponsors. We really appreciate the support for our work. It allows us to provide these webinars free to our members and to consumers and advocates in Kentucky. United Healthcare, Humana, AARP, Kentucky, Anthem, Unite Us, Passport Health Plan have all signed on to be sponsors this year. And we are really excited to be able to continue growing the work that we do. It helps us to provide not only these webinars for free, but also CEUs for social workers and certified community health workers. And we will soon be having CEUs available for even more professionals. So also stay tuned there. Before I go over the agenda, Kelly, can you skip to the next slide? I also wanted to share before we get into really today's topics. We are going to be hitting the road this summer, starting mid-July. We're bringing our Thrive Kentucky Roadshow to you in every area development district around the state. So we'll be doing 15 regional sessions. And it won't just be the information that we typically cover during our monthly, state and federal policy updates. We're going to be covering a few more topics. You can see the agenda items there, talking about civic engagement, but also childcare and transportation, suicide prevention, some topics that we don't cover typically every month. And then we are really focused on providing this education and additional support to our boots on the ground sort of frontline workers in communities who are serving members of your community who are working with these safety net programs on regular basis and want good information, good resources and tools. And so again, we'll have CEUs available for certified CHWs, for social workers, and for other professionals. There's a link to register. We have a flyer. There's a landing page with more information, but just really encourage people to go and register for a session in your community and to share the information with your networks. And so now I'd like to jump back to our agenda for today. You can see all of the topics that we'll be covering today. We've got a big agenda. We'll start by giving our guests from the cabinet the floor to share any updates with us. We'll have some discussion questions moderated by our ThriveKY partners. And we've found that it works best for people to kind of chime in through the chat with any questions or comments you have as we go along. Don't feel like you have to wait until the end. We'll try to answer those as we go as best we can. If we get more questions than we can get to during the next 90 minutes, go ahead and put them in the chat because we will get back to you via email with some written answers if we need to. And just before we begin, some quick housekeeping. We are recording this webinar, so you'll get a link to the recording, you'll get the slide deck, you'll get the chat, any resources that are shared there. And we also send out an evaluation. We love to hear your feedback on what was useful, what you'd like to have more of, less of, and that helps us as we're planning for our next session. And again, if you do need CEUs, then you can reach out to Kelly and she can help you with that. So with that, I think we can get started. And I believe that I am up first to talk with Deputy Commissioner Veronica Judy Cecil about community health workers. And as many of you know, I'm a big fan of CHWs. I think that community health workers just do so much to address the basic needs of Kentuckians in their communities, to really address a lot of the disparities that we see in health. And beyond healthcare, CHWs do a lot around helping to connect people with resources like food, transportation, housing, serve as liaisons between patients and their healthcare providers, a very complicated and hard to navigate healthcare system, social services. And for all of those reasons, we think that CHWs are just really critical to the communities that they serve. And so, beyond that, they're trusted members of their community, and they've really been on the front lines of the pandemic and all the various challenges that a community faces. And something that I'm not sure everyone is aware of, the Affordable Care Act, which signed into law in 2010, but in 2014, it actually made it an option for states to reimburse CHWs through Medicaid for services provided. And there have been a lot of sort of moving pieces here, a lot of steps that had to be put into place by the cabinet in order to make this a reality in Kentucky. The Department for Public Health and Department for Medicaid Services for years has been working with stakeholders, with CHWs and other advocates to put those steps in place. Certification was a huge piece of that. And now there's work being done to look at what that reimbursement mechanism will be. You probably heard, if you tune into these calls with us or are part of our newsletter, you've definitely heard that there was a bill sponsored by Representative Kim Mosier during the 2022 General Assembly, and it was passed, House Bill 525, to make community health workers, certified community health workers, Medicaid billable. And we're very excited, for this step. So happy to have Deputy Commissioner Veronica Judy Cecil joining us today to tell us a little bit more about, what those next steps are, how stakeholders can be informed and, kind of stay in the loop and have some voice in this process. And so do you want to share some basic updates with us before I get into some of the questions that we have?
Yeah, actually let me do that, and then maybe I'll even address some of the questions. Thank you, Emily. Good afternoon, everyone. Great to be here with you all, and I appreciate all the work that you do out there in the communities. It's vitally important to support our Medicaid members, so we greatly appreciate it and appreciate you. as Emily mentioned, I think an important part of this was the need for a foundation. So we were approached many years ago about coverage of community health workers, and what we identified was that you can't really provide a Medicaid cover service unless you're certified or licensed or registered. So there was definitely, I think, a lot of work that had to be done to get us to the point we are today, which is to actually talk about the next steps of, how do we make it become Medicaid reimbursable? So a lot of great work that's gone into this, definitely our sister agency, the Department for Public Health, and all their efforts. So that gets us to where we are today. Prior to House Bill 525 being passed, a lot of work was already going on around how to make them, what does a model look like for Medicaid? So we were already meeting regularly with Department of Public Health, and we have brought some other stakeholders to the table to have this initial conversation. It's not really trying to be exclusive, but rather, I think find it best that if we can understand through research what are the options available, and then come up with something to then put out and get public input on, typically then results in the best possible model. So we have been meeting regularly. What we've been looking at are what other states are doing. Commissioner Lee, through her Medicaid Leadership Institute, has gotten some wonderful national technical assistance. And so they've been providing a great deal of help to us and trying to understand how, really kind of dig more into the weeds on how other states are doing it. I think what always happens is that we have to figure out what's best for Kentucky. So we're not like any other state. And so we have to find a model that works best for us. I think that the couple of models that are out there, and one thing the legislation, thankfully, I think gave us flexibility on is, do we do it through a state plan? Do we do it through a waiver? And by waiver, we just mean that allows us to pilot some innovation and some things we wouldn't normally be able to do in a state plan. So the states have, the states that have Medicaid coverage for certified community health workers are doing it in various ways. Some have it in their state plan, some are doing 1115. So that's a big decision to make. The other thing is, what we're looking at is how can we, this is about serving the member. And so how can we best ensure that there's, no duplication of effort? Certainly, if every provider goes out and gets a community health worker and is trying to serve the same individual, I'm not sure that's in the best interest of the individual. So we have to really think through, how do we monitor that? How do we ensure that there's collaboration and coordination among providers and with Medicaid on the individual that's providing that service, the community health worker providing the service. So we are, our deadline is January 1, 2023 to submit something to CMS. I think we're, getting more down, more down into narrowing what is it, what is the best model for Kentucky, and then how do we make it unique to our state. And it's at that point we'll then release something for public comment, and we do plan extensive public input because we want this to work, and you all in particular out there around the state and working with Medicaid individuals, have a lot to share on what that might look like and what's feasible. So not a lot of details other than we are working on it and hope to have something out for public comment in the next couple of months.
Great, thanks. Those are good updates to have. And one question specifically beyond just like the reimbursement model, which I know is something that, different states are doing differently. And it seems like we need to really come up with something that's going to work well for Kentucky. But community-based organizations in particular are really kind of on the front lines of this work. You know, if you think about the more pure sense of community health work, it is people in their communities serving their own, you know, neighbors. And we want to make sure that those CBOs that are employing CHWs in their communities are going to be able to participate. So I know some thought has been given to that. You know, in some states, there's something called the hub. I wonder if you can just share a little bit about how that might work.
Sure, absolutely. So as Emily mentioned, there is a hub, and what the hub does is make sure that, you know, it might be covering a certain area, and it'll make sure that there are people within the community certified community health workers there in the community that can provide that service. And so it provides sort of an administrative type oversight. So in that regard, then it does allow sort of the I think, typical provider to be able to provide the services like a community-based organization. So as long as, again, you know, as long as they're meeting the requirements, the mechanism for billing for those services would be easier through that model.
That's really good to hear. And I also just wanted to make sure that people were aware that there is a new Office of Community Health Workers in the Department for Public Health. And we're just excited to see that, you know, sort of growth happening. I know there are a lot of new CHWs being trained through some grant funding that the Department for Public Health has been putting out to a lot of community-based organizations around the state. And so we just really appreciate the work that the cabinet is doing there to expand the network of community health workers and to strengthen that network, and excited to work with you all. So when you have any specific dates for meetings, please send them along and we'll get them out to our networks. And I also just wanted to share with everyone on this call that there will be a ceremonial bill signing for House Bill 525 July 15th. At 12:30 Eastern in the Capitol Annex, and all are welcome. So I'm going to put that in the chat for y'all now. And I will turn it over to my colleague, Kara Stewart, to talk about House Bill 7.
Hi, yeah, so House Bill 7, I'm sure everyone remembers because there was an incredible amount of messaging around it. What may not be clear is exactly what actually stayed in the bill, because many changes happened to that bill from the beginning of the session to when it became law at the end. So I thought just setting up, of course, the things that we're happy about staying the same was BBCE, the broad-based categorical eligibility, remains in place, and SNAP change reporting requirements stay the same. Some of the things that were really sort of scary at the beginning in House Bill 7, and that CHFS will have 12 months instead of 60 days to complete Medicaid determination following the end of the public health emergencies. That was questioned, and that hospitals will not be subject to penalties related to Medicaid PE applications. So that there are a lot of things changing, and so I would like to invite CHFS to share with us some of the specific timelines and about what is changing. For example, I know that we've got waivers for SNAP work reporting requirements, like we requested if unemployment goes above 10% or job availability in a particular county. So talk about those timelines, as well as establishment of the benefits cliff task force and what CHFS will be contributing there, if anything, and the single EBT timeline and the voluntary job placement, and the developing of the Medicaid community engagement program. So, and the report to LRC. So, I'm not sure, is Carrie, are you?
Carrie, yes, Carrie Banahan.
All right,
Thank
Carrie,
you for
thank you
having
so
me here
much.
this afternoon. Yes, so just a high level overview. So, some of the provisions are effective July 14th, 2022. So of those, as Kara had mentioned, are the SNAP requirements. Work requirements in counties with severe economic conditions defined as unemployment above 10% or meeting the federal impossibility standard. Also, self-attestation of income can only be used as a last resort in public assistance determinations. and consideration of fluctuating income for a more accurate eligibility determination. New and more severe penalties for fraud and misuse of benefits effective July 14th. So for Medicaid, it will be $500 per offense. For EBT card fraud, recoupment from current benefits and possible ineligibility periods for future benefits. A benefits task force is established to review the impact of public assistance benefits on labor force participation, employment, wages, and benefit duration, and make recommendations for families to transition off of public assistance. I believe the task force begins in July, and I think they have to have a report to LRC by December. Also, effective July 14th, the Department for Medicaid Services will no longer be designated as a qualified health entity for presumptive eligibility determination. This means that the presumptive eligibility form on the Cabinet's website will no longer be available, and Kentucky will revert back to the PE determinations prior to COVID. So individuals can still apply for PE at hospitals if they've received a service. And then I think pregnant women can apply at primary care centers. We're working on a proposal for a benefits cliff calculator and working with the Workforce Development Cabinet on a jobs posting database. Those proposals are due to LRC by September 1st. So with the benefits calculator, you'll be able to enter your income, household size, other information, and it will tell you at what level you will no longer qualify for public assistance benefits. KY Stats has a benefits cliff calculator. You know, we're looking at that as well as what other states are using. A report on the fiscal impact and cost of utilizing a single EBT card for public assistance of benefits is being developed. Originally, I think House Bill 7 required that all public assistance benefits be on a single EBT card, but that was changed to a study. Beginning January 1, 2023, the Education and Workforce Cabinet is required to establish a voluntary job placement assistance program for Medicaid enrollees that are over 18 and under 60. And beginning April 15, 2023, if approved by CMS, DMS is required to implement a community engagement program for able-bodied adults without dependents. And then July 30th, 2023, a report is required of hospital presumptive eligibility determinations to determine if they are in compliance with state and federal law. So we have a wide time frame, you know, from July 14th of 2022 up through June of 2023. So, and that was just high level. You know, there were other requirements in the bill that I didn't hit upon, but happy to answer any questions.
I would say the only follow-up there is the timeline for the basic health plan.
So yes, so with the basic health plan, we're looking at implementation for plan year 2024, which means we probably actually implement that like November 1st of 2023 during open enrollment.
Okay. Sorry, all of my questions were very date specific.
Oh, no worries, no worries. So
there's a lot of dates coming up
that there are to keep track of.
All right, well, I think, and Kent, yeah, we can send those to you. Tyler has a question, his hand's up.
Yeah, thanks. Tyler Offerman with the Kentucky School Justice Center. Carrie, I just wanted to clarify for the enhanced penalties for fraud and trafficking on the EBT card, as well as SNAP purchases. It's my understanding that those violate federal law, so the cabinet wouldn't be implementing the pieces that run afoul of federal law, correct?
So I guess, Jason, I'll have to defer to you on that. So.
Sorry,
well, we can get back to you, Tyler. Yeah.
I was reading a section of House Bill 7. The questions about the penalties for trafficking. Yeah, you know, we can't really go beyond the federally outlined penalties for that. So I think we'll have to look real close at what we can really implement with that because
Right.
it's such a federally prescribed program.
And we'll certainly engage our legal counsel at West
Right.
Dugan and have him look at that.
Right.
I'm curious.
Go
sorry.
ahead, Kent. Go ahead, Kent.
This is Kent Gilbert
Yep.
from the Kentucky Council of Churches. I'm curious, Ms. Manhan, what notice has been given to current recipients of benefits? How are they being informed of these changes, which are drastic?
Right, right. So I guess at this point in time, they are not being notified of these changes.
We are not notifying recipients of these changes?
I will get back with you on that, but I'm not aware of any specific. Are you talking about written notice to recipients about these changes?
Yes, I'm absolutely
about written notice of these changes. So
that's unconscionable to not be thinking about that. So I certainly hope that anything that can be done will be done immediately. This is essentially like changing the rules and not telling anybody that they've changed the game. And I think that's a recipe for disaster. And it's also just patently poor practice.
Yeah, I mean, I would love it if the members of the General Assembly who passed House Bill 7 would send it out to their constituents and let them know that why they passed it. I would prefer that. But yeah, there's got to be ways to make sure people continue to know that this is because of House Bill 7 and who passed House Bill 7 for sure.
Well, and I think too that there's a lot of confusion out there, not due to the cabinet, certainly due to the various versions of House Bill 7 that we saw and that we were communicating with people about during the General Assembly. And so I think just for that reason alone, what actually passed and what that looks like in implementation is good information for people to have, because some people, assume that there will be asset testing now, and we know that that's not the case, but not everyone, is aware of that because things change so quickly and it was hard to keep track of one version to the next. So I think it would be really helpful. And if it can't be a written notice to, everyone in their, mailbox, if there was something posted, a memo that we could share through our networks, that would also be really helpful.
Okay, all right, noted, and we'll take that back and talk to the secretary.
The timeline, the implementation timeline slide that you all gave to the Primary Care Association, I mean, I think that's something like KVH could put out on, if that would be all right.
Yeah, the timeline's fine.
Okay.
Yes.
Yeah, I think so. I think that's one of the other things is like we can all share, everyone who's here at this meeting, we'll send out like the slides and timeline with all those dates. And then we can also make a point to try to make sure to get that stuff out, because yeah, there's a lot of stuff, there's a lot of dates and a lot of stuff happening. All right, and if there's any other questions about that, then there's Priscilla coming up next.
Thanks, Kara. Hey, everyone. I am Priscilla Easterling, the Outreach Coordinator for Kentucky Voices for Health. If you've joined us before, or if you've read any of our materials, we've talked about this thing called the maintenance of effort. So during the last 2 years, during the pandemic, while the public health emergency has been in place, no one who has been enrolled in Medicaid has been disenrolled or has renewals have been happening, but passively. And when the public health emergency ends, this maintenance of effort will also go away, meaning that renewals will begin to take place again. So we have a sort of a moving target of a date, but we know that the state has been planning for what happens when the public health emergency ends. So I am happy to be joined with, I think Veronica is going to be answering these questions today. Can you tell us a little bit more about the state's plans and what all you've got going on?
Absolutely, and I have some slides to share, if that is okay, and I can, oops, if I can get permission to share. My bad.
You should have permission now.
Okay, thank you. Let me get it up to the right slide. Apologies. Okay, can y'all see that? Oh, wait, now can you see it?
Yes, thank you.
Okay, great. All right. So a couple of things I think it's important to note is that how many people have joined since the public health emergency. And as the slide shows, we have from March 2nd of 2020, which is what we kind of call the start of the public health emergency for us, till June 13th, we increased 327,000 people, which, you know, our goal throughout the public health emergency is to make sure people are covered. They need to have access to, you know, not only COVID treatment and prescriptions and testing, but, you know, what we do know is that from COVID comes other needs for medical care. And so we're very happy to see how many, I mean, it's both good and bad, how many people are actually covered through Medicaid. And we did increase presumptive eligibility during this time for folks. We do allow 2 presumptive eligibility periods. Under regular Medicaid, you can get 1. And we had been, the cabinet had been a qualified entity for presumptive eligibility. So we were able to get in those early days or months, you know, coverage to people who really needed it. So this just kind of shows you what that looked like during that period of time, regular Medicaid and PE. Again, we had a large number of presumptive eligibility folks. You see the drop off there. If you can see that, it's in July, between July and August. And the reason for that is people may, you know, hit the maximum of the 2 PE periods during that period of time. And so that therefore there was a large drop off. We have returned to kind of what we call our normal presumptive eligibility enrollment, and that's anywhere from like 1,200. We've seen right now we have about 1,700 presumptive eligibles, and so we see normally around 12 to 1,400. So for the public health emergency unwinding, CMS has guaranteed a 60-day notice to states so that we can, you know, ramp up, and we appreciate that. We did not get the one for July, so we are now expecting an extension to October 14th. So that's great news. So then the next notice day, 60-day deadline will be August 15th. So we'll just continue to watch to see what happens then. I will say that we meet with CMS regularly, both individually as a state, but we're on many calls with CMS for all the states to talk about unwinding, and we continue to learn. I think CMS continues to learn what the states are facing as part of unwinding. And so you will see that, you know, there's still guidance that continues to come out that we are incorporating into our unwinding plan. So what will happen is that the month after the PHE ends, we will be required to restart our normal operations for eligibility and enrollment. We have, as you see there, we have 3 primary goals. We've got to comply with CMS. It's always important. They pay, you know, the lion's share of our cost. But probably more importantly to me, and I think to the department, is that we prevent administrative terminations. So we are going to do everything that we can to communicate, to outreach, you know, and to ensure members understand what they need to do to prevent that termination. And then as part of that, you know, for those who are not eligible due to income in particular, to see what we can do to transition to other coverage. So there will be a lot of effort to move those folks who are eligible for the qualified health plan to get them moved over to that plan and encourage it and do whatever we can to assist them with it. So, primarily during this time, what has happened is, the individuals enrolled, there's a lot of self-attested information. And they, as Deputy Secretary Bannon had said, they've not been they've not completed an enrollment for a lot of that 300,000 that's been enrolled since March of 2020. They've never gone through a redetermination. So we have to be sensitive to that, and we have to recognize that and know that there's a lot of folks who are going to need help with that. So what Kentucky plans to, in our normal eligibility redetermination or renewal, we actually like to call it a renewal. We always notify individuals at least 45 days prior to that renewal period. We do have a communication, we are preparing a communication strategy, and as part of that, it's organizations and individuals such as you all, or managed care organizations, we're developing a plan where we can make sure that everybody understands what's happening, what they can do. It is important for people to have a clear understanding of how this affects them. I think it's also important that people hear the same information. So as part of that, we want to make sure that we're sharing the message and that everybody's sharing the same message, so that it helps reduce any confusion and provides the best service as possible to the individuals. So we are really looking at all communication modes. We're gonna text, we're gonna email, we're gonna call, we're gonna send letters, we're gonna post things on our websites. I don't know if you've seen, but the Department for Medicaid Services now has social media. So we have a Facebook page, a Twitter account. We're just now kind of in our infancy of using it, but we're ramping it up and are very excited to have that mode of communication, and primarily so we can keep people that actually do use social media informed about what's going on, so they can then pass it on to people who don't, because we do recognize that not all our members are on social media. So but we do think it's another access point for information, so we're excited to use that as well. But we do plan a lot of public interaction, so everyone understands what's happening during this period of time. This is a very rudimentary look at our very simplification of our process. And like I said, what we'll do, and I'll show you a timeline in a minute, but what happens is that once we get that 60-day notice, our system will flip the switch. Our system will start processing the renewals. And what that means is it'll be over 12 months. Not everybody's going to be processed. Initially, we're going to spread that over the 12 months. But what it'll do is it'll process, and then it'll make a determination as can somebody be passively renewed, which means we were able to verify information in the system, there are no other questions, and if so, they'll receive a notice of determination. But for those that for some reason we couldn't verify, or we feel like we do need some additional information, they'll drop to an active renewal. And so they'll go through that top line where they'll have to submit some type of documentation. It'll get uploaded to Connect. And then once uploaded, it'll get reviewed for a final determination. That, again, is very simple, but what we expect during that period of time for that top timeline, for that process flow, is that a lot of interaction. So we will be sending managed care organizations lists of people who are going through that directly so that they can help outreach. We'll be doing a lot of outreach to the individuals. So like I said, through text, email, phone call, or written communication, we'll be reaching out. We do not want people to go through an administrative termination unless, ultimately they are not eligible. So we'll be working a lot during that period of time with primarily our managed care organizations to work with their members on making sure that we have the information we need.
Great.
Yes.
I had a quick question.
Yes.
If you go back to your last slide really quick, at the step where it's the notice of determination, no additional steps, if someone is disenrolled at that point, do they have any options? Can they like reapply? Do they resubmit information if they think they're still eligible? What would you suggest at that point?
Sure. Yeah, so, people can always appeal. And then anybody who we determine after the notice, if it was an unfavorable notice, and we later determine they're eligible, it does retro back. So there is no gap in coverage for anybody that might go through that scenario.
Perfect. Thank you.
Great question. Great question. So, okay, so then this is again, just a working document. This is actually the first time we've shown it in public, but and it's a moving document, right? Because we don't know when this is going to happen. So this is we updated this to reflect if the PHE ends on October 14th. This is kind of what that timeline would look like. Again, right now, what we've been doing is identifying our system changes. We've been looking at what the flexibilities that were implemented for COVID, what can we keep? And I can assure you we're really interested in trying to keep as much flexibility as we can. So system changes, communication plan, and those are kind of the primary things right now. What we do plan to do is gather more as we kind of work toward finalizing those like the communication plan is to reach out to more stakeholders and bring them in and see, does this look good? What are we missing? How can we enhance this? How can we make it better? So we do plan to do that prior to when the notification period happens. We've already requested some additional flexibilities that have been approved. So we'll be, including that in information that we send out to folks as that approaches, so everybody understands what's staying and what's going. I think that's critical, especially with providers in recognizing what they've been able to do now and what they cannot do after. So we plan a lot of communication around that to make sure everybody understands what's ending and what's not. I think the other thing I wanted to note here, so Appendix K, for those of you who might not be familiar, is the document or the authority under which we have the ability to do certain things with our 1915C waivers, so the home and community-based waivers. We've asked for a lot of flexibilities under that. Some of that has been around payment, but then some other things that we've been able to waive to ensure that members are getting access to the services they need. What's kind of really going to be good for us is that that we have an additional 6 months after the PHE ends to unwind those flexibilities, unlike all the other flexibilities which would normally end as soon as the PHE ends. So just wanted to note that, but I hope that's helpful. Again, as we approach that next 60-day notification period and we finalize communication strategy and other things, we'll start being able to do a little bit more communication to folks to understand what's going on.
This is all so helpful. Thank you. So bottom line, the best thing that consumers can do, organizations should be pushing the message that consumers just need to update their contact information. And yes, from there, they'll get notices and they can act off of that.
Right. So a couple of things right now is we are encouraging, and you've probably seen our social media posts around update, asking for members to make sure their information is updated contact information. And that includes phone number and email. Because, as we know, sometimes that snail mail just doesn't work for everybody very well. And we recognize that. the other thing I wanted to mention is one of the ways we're leveraging the managed care organizations is allowing them, because they actually either directly or through providers work with the member and find out the member's address has changed or contact information has changed. So the MCO will be allowed to update the address and send it over to us. And they can do that now. The only thing is right now we have to, normally we would have to send out something to verify the information. We couldn't rely on it, but we've received approval from CMS to be able to consume that information and utilize it for the purpose of their updated contact information. So that's, I think, a great thing for members to try to reduce the inaccuracies that might be in our system.
Yes, that's awesome. That's a really helpful avenue. This is all really great information. Thank you so much, Veronica.
You're very welcome.
Thank you. If there are any questions or comments, just throw them in the chat. Miranda, I saw you just raise your hand.
Yeah, just had a quick question. That's exciting about MCOs being able to update addresses. When will that be effective?
The system changes are being made now so that we can go ahead and start consuming those.
Thank you.
All right, if there are any other questions, just put them in the chat and we'll make sure to answer them. Thank you. We'll turn it over to, I think it's Tyler.
Yeah, thanks, Priscilla. Hey y'all, Tyler Offerman with the Kentucky School Justice Center. I know that we are approaching a point where we will be tight on time, so I will try to be punctual in my conversation, not questioning, conversation with Jason Dunn, who is the director for the Division of Family Support at DCBS. So I guess just to cue us up, we're going to be talking mostly about the feeding programs, SNAP, PBT, and maybe wander into a couple other areas. But the stage that is being set here. So from April to May, SNAP benefits in the state dropped by $50 million. This is because the General Assembly ended the state of emergency, which was required to bring down the SNAP emergency allotments that were a result of congressional action around COVID. So if you got folks asking you why their SNAP benefits went down, it's because of that action by the General Assembly. So some folks may be going back down to the $20 minimum. Others, it's the sliding scale between 20 to 250 for an individual, different for a household. But so those benefits went down. Food prices are, I don't think skyrocketing would be an understatement. I think on average, food prices have gone up 7%, but for things like ground beef, I think they're up about 36%. So, folks are seeing less SNAP benefits, they're seeing higher food prices, and that's resulting in a lot of folks seeking assistance, both from the feeding programs, but also food banks and pantries. I know many are looking at 30, 40, and 50% increases. Some are saying this is the highest they've seen it during the pandemic. So there's obviously a lot of need, a lot of challenges for people to access food and be able to feed their families. So Jason, first, there's several programs that I know that there could be updates on, PBT definitely being one of them, but figured I would hand it to you for PBT and SNAP first, and then we can see what else we get to.
Sure, we can absolutely talk. Well, before we go into that, Kent, we did send a notice to everybody when those emergency allotments ended. So we made sure, actually, the governor's office wrote it, and we were very grateful for their wording that they provided. It's exactly what I would have wanted to say too. But just so folks knew what the conditions were that led to the loss of those benefits, and that their goal was to try and help take some of the phone calls off of our staff too, right? So, but anyway, for PBT, we did our first issuance for the 21-22 school year on May 25th-ish, around there. It might have been the 26th. We didn't have all the schools' data in time for that issuance, so we issued the data that we had based on the data that we had. We have caught up quite a bit on the schools providing that data. When you copy their superintendents, it really helps. But we are down to 4 school systems that we don't have the information from yet. So we continue to work to try and get those. But, we have all of the large school districts, and being down to just a handful is quite the feat already. We've been doing some catch-up issuances as we've been getting these the data from schools who were a little bit late in getting the data to us. The first issuance was around $8 million. The second issuance was around $8 million. And by and large, those issuances covered from September through February of the school year. The next issuances are covering the rest of the school year, so March through May, a 3-month period. And those issuances are going to be a lot less. Kids were in school more this year. We had to come up with a plan that recognized, that kids were in school, and we just could issue benefits for those days that they were absent. So as you can imagine, verifying the attendance records of every school student in every school system for the school year is quite the feat to get that kind of data from schools. There's 170 plus districts in the state, and they're all a little bit different in how they collect data. So getting everybody on the same page has been a fun task, but we're getting there. We have one more issuance coming up in early July. That's another catch-up issuance, and then we'll have another one 2 weeks after that. So we have the 8th of July on that Friday, and then two more weeks. That Wednesday, we'll have another issuance in July. We should be caught up with the regular issuances by then. What we're also doing, in addition to those regular issuances, because we're still getting that data in from schools, we're doing reconsiderations for those parents who said, you gave me benefits for X number of days, but my child was actually absent more days than that. We are taking those reconsideration requests, sending those to school systems to check their records again. We've received over 2,500 of those, and we're down to about 1,000 of those that have been left. My staff has reported to me that those reconsideration requests have come back very quickly. So we're pleased with how quickly we're getting the reconsideration requests. Once we have that last issuance that we're aware of, we'll still keep that reconsideration window open for at least 10 days to have folks say, no, this wasn't the correct amount. At least 10 days, maybe a little bit longer, just depending on how the issuance falls and how many days folks might have to report that to us. Either way, what we've done along the way is keep updates on our Facebook page, the DCBS Facebook page. You can go through and see a timeline of what schools had submitted their data and what schools hadn't, and catch up that way. We wanted to make sure folks were aware which school systems we had at the time and which ones we didn't, so they knew what to expect and when to expect their benefits. We are working on the summer PEBT plan, and that is going to be much like last year's summer plan. So almost every student in Kentucky should be eligible, who is eligible for the free and reduced lunch. I was trying to go back and find the amount of $391 per student, and that covers the entire summer months, 3 summer months.
And
June, July,
Jason, just
August.
refresh my memory. I know
Yeah.
it was only last summer, but it feels a lifetime ago. And that is that's basically a one-time lump sum payment.
Yes.
Okay.
Correct. So that'll be a significant amount. It will probably be a more significant amount than the school year PEBT that we've already issued this year. That's one that I want to keep the retailers aware of, because that'll be a lot at one time. So
any clarity? I know we have to go back and forth with FNS on that plan, I assume, but are we looking late summer?
Probably late summer. I think that our system programming that we established for last year should be the same. If there's any differences, of course, there'll be some system development time, and should be able to do it quickly, but that always does add more time. I'm hopeful that we don't need to do anything like that. We have a meeting with, there's a couple of things we need to clarify with FNS. We have that meeting with them on Friday, so hopefully we'll get that plan completed Friday and off to them. If not Friday, then early next week after the holiday.
Right.
But that is about it on the PEBT update that I have for now. I'm just really thrilled that we're down to 4 school systems at this point. I was really worried about the fact that we hadn't heard from so many at one point, including a couple of very large school districts. But we have those taken care of now.
Great.
I don't know if anybody has any additional questions. I think I've told you everything I know, so I may not be able to answer them, but be happy to take them back.
PBT and summer EBT are always hot topics. Do folks
Right.
have any questions? I put the new FAQ in the chat. Most answers should also be found there.
Right.
But cool. If not, you know where we work, so please
That's
reach
right.
out.
Okay.
So just a little bit of a tangent back to the House Bill 7 conversation, but not quite. So on the SNAP side, just are there any updates? I know that participation seems to be steadying out, but ticking back up. We saw a big drop sort of as the pandemic, well,
as the
who knows
pandemic
what's going
wore off,
on, but
yeah, as the pandemic wore off, and as we had to reinstate renewals, the required renewals, we had to do that earlier than the Medicaid program, of course, but we had to do those beginning last year. So so that kind of attenuated the caseload somewhat. But yeah, we have seen a little bit more of an uptick in the last few months, for sure.
And I know that there's a couple things in House Bill 7 that pertain to SNAP. One was mentioned earlier, and that is the time limit waivers for non-dependent, non-relief folks. But it's my understanding that based on the way that that bill passed, so that nothing will change until the end of this year, but then those time limits will only go into effect for certain counties. And I assume y'all will have a list of those counties closer to that date.
We will, but now, you know, the public health emergency has continued on to the point. Right now, we have a statewide waiver that's good through the end of November of this year. But if the public health emergency continues beyond November, if it goes to the end of the year, we will follow the public health emergency guidelines and still have a statewide waiver until the public health emergency is over. So whichever of those things comes first, then we will have to see what counties we are able to exempt under current guidelines by the federal government. House Bill 7 originally had that 10% unemployment trigger, which was a very hard bar for any county to meet, but there are other economic indicators and other economic conditions that can allow a county to have a waiver. So we will certainly be looking at all those wherever we can.
So we'll have at least one or two more of these before that decision is made.
Right.
So I assume we'll be able to share that information
Absolutely.
here. But the moral of the story is nothing will change until the end of the year on that front, and
Right.
folks get updates before they do.
Right. Right.
Okay. The
And
only
Kent
other
will send
thing,
notices for those too. So
yeah.
just so you know.
The only other thing on House Bill 7, so the Elderly Simplified Application Project and the medical expense deduction were both things that would help elderly or disabled folks gain a maximum amount of SNAP benefits. Any updates on when y'all think those will be shaken loose?
We don't. We're researching how other states have done this. Of course, we have 180 days so we have until the end of the year basically to implement those. For those who aren't aware, an elderly simplified reporting or elderly simplified assistance program really just takes a couple of the standard administrative requirements off of elderly households, so we can provide them longer certification periods, or maybe they don't have to do the periodic report that most households have to do and can trip people up sometimes. So we'll look at all the different ways that can be done. It's not a one size fits all. So we will look at implementing all of those things that we can. And then of course the standard medical deduction, we do offer deductions for elderly and disabled households for medical bills that they have to pay. And it can be quite the administrative burden to try and figure that out. So if we can establish a standard deduction that all elderly and disabled households can get, that'll help both the households and our agency in administering those. And of course, if they have expenses over that standard, we will verify their actual expenses. So it's not like people will lose out.
Sure, but kind of similar to the SNAP time limit waivers.
Yeah,
we'll know closer to the end of the year. We'll be able to get that information out to y'all. But yeah, for folks that work with elderly folks, especially those on SSI or people with disabilities, this will be some positive changes to the SNAP program that should make it more accessible for those folks.
Right, and those are the households that I've been the most concerned about, because with our loss of participation in the program over the years, that's the population that seems to be hit the most, or the elderly and disabled folks. So really concerned about how far we've gone down in participation there.
Cool. Thanks, Jason. The only other sort of questions that I had was, how's the call center doing? About 6 months ago, I know wait times were pretty high, but I know y'all have taken several actions to try to address that. And then just any other updates or requests you might have.
Oh, sure. We have the phone lines are better. I'm not going to say they're perfect. They're better than they have been in the past. One of the changes made recently in the last month or so, if somebody was calling in just to check on the status of their case, those all went to DCBS workers. We now have kind of an intermediary step, and that's the first step that they get to when they call in. Is we have some staff that are trained to just answer those easy questions, like when's my next renewal, or how much of my income are you counting, how much are my benefits again, those kinds of questions that somebody can answer quickly or answered on the front end. If it needs to go to a worker, then it can go to a worker. We've been able to, just making that one simple change, we've been able to answer a far larger number of calls. The wait times have gone down. They're not great, but we want to continue to make tweaks like that to get the call level down. We're also hiring staff, and I'm not in that part of the world of DCBS on the hiring of the field staff. I know we're up, but we still struggle in some areas like Jefferson County. But with recent upgrades in wages and everything, that's been improving. So our ability to hire and retain staff has been improving. So we hope that continues as well.
Thanks, Jason. The only other food related thing, and then I can pass it to, I believe, Kelly, is we do not, this is a CHFS forum, not a Kentucky Department of Education forum, but Congress did pass the Keep Kids Fed Act recently. It extended right before the deadline here. Congress really operates under a tight crunch, but did extend a number of the summer child feeding waivers through the end of the summer. I'll put some information in the chat just so folks know about it. But I know our food service directors and other folks that work with the schools were very, very, very anxious about those ending. So some slight reprieve for some of those summer feeding programs. So I think I am done and I can pass it on.
All right, thank you guys. And for anyone who has any lingering questions, just please drop them in the chat. And I know Tyler and Jason will get to them. My name is Kelly Talby. I'm the Director of Communications and Development for KVH. And we are going to be crunched on a little time here. So I'm going to do just a very brief intro. But as you all know, vaccines have become an ever-pressing topic for many reasons, not just as we battle COVID-19, but as we see routine immunizations for children especially. So today we're going to kind of cover on some of the rates and trends and good news, like the 6-month-olds to 5 years of age group getting recently authorized for their COVID-19 vaccine and what parents need to know. But then also cover some of the more concerning indications that we're seeing. And so I will let Dr. Connie White, Deputy Commissioner for the Department for Public Health, she's sharing her screen now and kind of get into some of this evidence-based information that we want to share with you and talk about today. So Dr. White.
I wasn't trying to step on you, Kelly, but I didn't want to take my part of my time going, now let me figure out how to do this. So thank you very much for letting me be here and be a part of this today. I'm going to go right at the beginning, and I'll do this briefly, but I think it's important. If you have not gone to the website, this is what the website looks like. And usually people see that map down there and they go, okay, that's all I need to know. There is so much information on this website. And I'd like you to go to, well, and I just went to the wrong place. DPH data, especially if you're a data geek. There is more here on this page than you would ever want to know about any topic, but I'm very interested in the vaccine dashboard. If you go to this dashboard, it is updated once a week, and up in the upper left-hand corner, it will tell you 1 dose, fully vaccinated, and additional boosters by total population, by percent of the population, by greater than 5 years of age, by greater than 18, and by greater than 65. So if you want to know how Kentucky is doing, you can see it in that field. Also over here on the right, you can look by different age and see how many children or how many people of those age groups have had a vaccination, and you can then look what's the percentage of the total Kentucky population. Then, and I'm picking Taylor County because that's where I was born, so I always pick Taylor County when I'm doing an example. If you pull up Taylor County, it will give you by first dose that very same age range breakdown, number, whole number, and percentage. If you want to look at fully vaccinated, you can do that for your county. And if you want to look at any other additional doses, you can do that by your county. You can also do that by the entire state, by first dose, fully vaccinated, and boosted. So I thought that was an important piece of information for us to go with. Oh, I did stop sharing, and that was not what I meant to do. So I think those are important things for everybody to be able to look at your particular county and where you are. Of course, now I am completely lost my mind trying to be brief here. So I wanted to talk about VFC, Vaccines for Children. That's the program in Kentucky, or in all the states. This was started back in '93 it's a no-cost vaccine program trying to keep kids in their medical home to get their vaccinations for kids less less than 19 years of age. I'm bringing this up because not only are we talking about COVID, but we're talking about all other vaccines. And what we ask our VFC providers to do is in the spring, they order vaccine that they're planning on using in the fall. If you look at Kentucky's grand total of the total numbers of vaccines that the VFC providers ordered June 17 to September 19, this is the total number. If you look what they've ordered for this coming fall, they've ordered 16% less than they ordered back in this 2017 to 2019. And if you break that down by rural providers versus urban providers, 25% less ordering by our rural providers. Now, the US is down as well, but the US is down in their ordering by 5%. Kentucky is down by 16%. We're very concerned about that, because we know that through the pandemic, kids have gotten behind on their vaccines. So that's why we formed a coalition. You can see all these folks here that are part of this coalition, and Voices for Health is one of them, where we've been doing a series of flyers. I like this one because I really like this little dinosaur in that QR code. I'm still not sure what a QR code is, but they're cool looking, and it's what people want to be able to get the information that they need. That takes you to the vaccination schedule at the CDC. Here's another one that just reminds people they need to protect their families. Here's another one that says, are you planning a trip? Everybody needs to be vaccinated. So trying to get the word out in as many different ways as we can through all of these partners down here. They have these flyers. They're sending them out through social media and lots of different venues. As far as what do parents need, or what do caregivers need to know about children, this is hot off the press, as in a few minutes before I came on to talk, this was finalized. And this really takes it for your kids by age, and by how many shots that is, how far apart, and what size that dose is, because there's been some concern with some of the caregivers that they thought the kids were getting the same size dose for these littler kids, the under 12. And this just explains that. And then it tells you whether they are eligible for a booster. This top part is for Pfizer. This bottom part is for Moderna. This will be posted by the end of the week. I hope tomorrow, but by the end of the week, this will be on our website. So you'll be able to find that as a caregiver. I'm sorry, as a caregiver to a child. So you'll know exactly what's out there and what's available. You need to go to the provider that takes care of your child to get these vaccines. We're very hopeful that they'll start being provided with the other childhood vaccines. If your provider doesn't offer it, then again, look to social media. This is a post by the Lexington Health Department. I picked this one just because it was colorful and I could find it quickly to post on here. But there are different practices. Some large pediatric practices are going to be offering some clinics on their own. And even if you don't go to that particular clinic, you can go there to get your vaccination. So there may be a little bit of detective work that needs to happen. And I'm going to go back to that website, the ky.gov website. And if you go under vaccine, you will see this blue box down here that says go to Vaccine Finder. And if you click right there under Vaccine Finder, this is vaccines.gov. And if I put my zip code in here, and if I say I'm interested, and I'm just picking this out of the air, Moderna for a 6-month to 5-year-old, and I tap on search for vaccines, it's going to bring everybody up within so many miles of me. It's going to tell me how far away it is. It's going to give me the link to that particular place. It's going to tell me that they vaccinate up to whatever age it is, and I can click to find out if an appointment is available. So I think that is an important piece of information for all of our family members to know, and any way you can share this would be great. Another thing I want to share with you, and this is another website that's very new that we're very pleased with, and this is an immunization specific website on the Cabinet's website. So this has got everything you want to know about vaccines, COVID as well well as other. In fact, it even has the adult vaccine schedule because we adults ignore the fact that we have vaccines we need to be getting as well. So all of these are links to the CDC. So that way you're getting the most up-to-date information. So if the CDC changes a recommendation, it's going to be here. So you've got the childhood vaccine, the adult vaccinations, the childhood schedule, and you can also go down here and you can click on those instructions in Spanish, Somali, Chinese, Burmese, and French. So these are some things that I think are helpful for people to know. I wanted you to be aware that we have developed a school immunization branch in maternal child health. So we now have a branch manager, and her job is to work and make sure that we have good collaboration between the Department for Public Health, not only in Frankfurt, but because we work very well with the Department for Public Health school nurse, but also we have now deployed public health people out into all of the school districts, and they're working hand in glove with the health coordinators in all of the districts. We are working close. Of course, we're working with the community health workers, but also working very much with Friskies, and we have a really renewed relationship with them. And so Friskies are such a great resource for you as far as getting vaccinations. They actually have money to help with transportation. I know transportation, some of the MCOs offer transportation, but check with your Friskies because sometimes they can help make sure that that child that needs a vaccination can get there. So we're doing a lot of work, and I don't want to take any more of Dr. Schuster's time, but please put questions in the chat. I'm happy to address them. And I did my cardinal sin that I always try to do is put my email address in my PowerPoint. So I will put that in the chat so you can have that if you have pressing questions, and if I can't answer them. The good thing about my job is if I don't know the answers, I know people that do, so I can find those out for you. And I'll put my email in the chat right now. And I will share the slides. Yes, I'll get the slides to you, Kelly, so you can share those.
Perfect. Thank you. Thank you so much. And I know we sped through that and it was a lot, and it's a lot of resources. We will be sharing all of this in a follow-up email tomorrow for anyone who's joining us for the first time. And with that, I'm going to pass the digital mic to Dr. Sheila Schuster.
Thank you. And thank you, Connie, for speeding through. I'll talk fast as well. I'm Sheila Schuster. I'm the Executive Director of the Advocacy Action Network, and I'm here with some great news. We are very much a part of the national rollout of the 988 Suicide Prevention and Mental Health Crisis Line. This has been in the works for 2 years. It's going to roll out on Saturday, July 16th. And I have the pleasure of having with us Dr. Patty Clark, who is Program Director over at the Department for Behavioral Health, Developmental and Intellectual Disabilities. Dr. Clark has led the charge on suicide prevention, and she and Beck Whipple and now Angela Parker have done a great job of bringing together a coalition around 988 and a coalition around 988 funding. So I'm going to turn it over to you, Dr. Clark, to fill us in a little bit on where we are with implementation, if you would do that. Thank you for being with us.
Thank you, Dr. Schuster. We are literally 18 days. Every time I do this presentation in the last few weeks, I'm counting down the number of days to the launch of 988. So on July 16th, we will go live. Kentucky is obviously just part of one of the states across the nation. The entire number will roll out nationwide. And for the first time, we will have a 3-digit easy access way for folks to access mental health and substance use crisis services. So it's really important for us to remember that for the most part, this system has been in place for about 2 decades at this point. There has been a 10-digit number, 1-800-273-8255, that has been in place, and the 988 infrastructure is just laying on top of that. So this is not a new system. It's just adding that 3-digit calling number to that current infrastructure. What we have been working on is really expanding the capacity of our centers across the state to be able to answer crisis calls, because we know with 988, we have an easy to remember number. We're going to have higher calling higher number of calls, which means that we need more crisis call centers to answer those calls. We also need to make sure that we have the workforce on the back end to address the needs of those folks as well. And so that's really what the 988 Coalition has focused on over the last 2 years. We have had a group of about, Margaret, I would say 75 to 80 people that across the 2 years that have joined us. Reach has been invaluable in our efforts to be ready for the 988 launch on July 16th. So I want to make sure that we recognize their work in this as well. We are planning to do a press conference on July 18th in coordination with the governor. It's scheduled for 10 o'clock that morning in the Rotunda. And so if you're able and willing to be there, that would be great. We're also going to roll out a website that day that highlights the access to information. I do want to note that we have intentionally not marketed 988 strongly so that we can give, as Dr. Brinzel says in DBH, it's a stress test of our crisis center, giving us time to do almost a soft launch of this process and make sure that we have folks in place to be able to answer those calls. So just to give you a little bit of the numbers around what we're seeing in our system at this point, over the past 5 months from January through May, we've actually seen a 14% increase in the number of calls that have gone into the National Suicide Prevention Lifeline. So that's January through May of 21 compared to January through May of 22. And between April and May alone of 22, we saw a 7% increase. So what's happening is we have greater need. So we've all heard the stories about increased mental health needs of our folks across the state, across the country at this point, as we're going into that third year of the pandemic. Higher acuity calls, which we're seeing as folks who are coming in with higher needs, they take longer to resolve. And so they take more of the time of our crisis callers. So we have to make sure that we have additional callers, not only to answer more calls, but also to answer those higher acuity calls as well. On average, it takes about 13 minutes for a call to be resolved, either to reduce the crisis enough that that person can access appropriate resources on their own, or for a connection to be made with appropriate resources in the community, whether that's a mobile crisis team, law enforcement, if it's an imminent risk, those kind of responses. We have about 100 call takers across the state, and we have a goal of answering 90% of all calls in the state by the end of July-ish. Currently, we're at about a 73% answer rate. That was for May of 22. But I just want to note that we had 3 new call centers come online at the end of April, which will allow us to really up that answer rate pretty quickly. We do have 13 of our 14 crisis centers across the state within our CMHCs that have been accredited. And we have all of our counties are covered with a primary coverage for crisis centers. And then we have all but 15 counties have confirmed backup coverage at this point. The Pennyroyal Center down in the South Central region is covering at this point for Comprehend up in the northeast part of the state. And then Pennyroyal is also providing some backup coverage to Fayette County this month as on a test basis. And then if they have the capacity to continue that, we will add Jefferson County. So that will allow us to have backup coverage for every county except the counties that Pennyroyal is providing primary coverage to. And we're working with other centers to be able to back those up as well. On average, we see about 1,955 calls per month. We expect that number to go up by about four times by the end of June of 2023, just for the reasons that I indicated earlier. Let's see, about 1,500 of those calls have been answered in state at this point too. I do want to indicate that it's important for us to remember that July 16th is really a launching pad and not a landing pad, a launch date, not a landing pad. 911 took about 2 decades to become really efficient in their services. And while we've learned a lot of lessons from 911 and its implementation, there are going to be pieces that we will have to learn in this process as well. And so we are ready, as ready as we can be at this point to be able to answer those calls. And so I'm open for questions. I know we've got a short amount of time.
Thank you so much, Dr. Clark. I just want to say that compared to other states, Kentucky is way ahead. Dr. Clark talked about our having these call centers for the last 2 decades because we were one of the first states to roll out a statewide system of community mental health centers. We've always had a regional model where every county in the state is assigned to a CMHC and therefore is guaranteed access to services. So I'm very proud of that fact, and I think that we have a lot ahead of us. We did get some funding in the budget to get us going, but I'm going to be calling on all of you all to help us with advocacy in the 2023 session. We need to make this sustainable, and the way to do that is the same way that 911 became sustainable, and that's for a very modest monthly fee on your mobile cell phones. So the question is it worth less than $10 a year to you to save lives? Because that's what it's going to amount to. It's going to be $8.40 a year. So I hope that we can count on you all for your advocacy. And I do want to recognize Margaret Pennington, who's on this, in the REACH group that have provided data and led the coalitions. I also put in the chat, there's going to be a 101 webinar on the 988 line. It's going to be led by Marcy Timmerman of Mental Health America and Megan Cole from the American Foundation for the Prevention of Suicide. They are our co-chairs on our funding coalition, and it's everything you wanted to know about 988. It's free. It'll be at noon, and the link is in your chat. So I think this is exciting. It's taken a lot of time, but mental health is in a crisis. We just had a briefing from Tina Robbins of DBH about childhood mental health has been in a crisis for the last 2 decades at least. And I feel like with racial trauma, with the pandemic, with now the recession, we are looking at, in the opioid crisis, we are looking at a confluence of suicide attempts, depression, anxiety. So we really need to get this resource out there. And I thank you very much, Dr. Clark, for your presentation. We've got 30 seconds maybe, or put a question in the chat and we'll get back to you. But we really appreciate your listening about 988, spreading the word when the time comes, and signing up for the webinar and then helping us in the 2023 session. So if there are any questions, appreciate you putting them in the chat. And thank you again, Dr. Clark, Margaret, for being with us today. And I guess I'll turn it back to you, Emily.
Yes, thank you again, everyone. I know we're at time, so just wanted to say again, thanks to our guests from the cabinet, of course, for joining us and sharing so much good information, very useful information for the work that we do. We'll be sharing all these resources in an email tomorrow, so just watch for that, and we'll look forward to our next forum. And in the meantime, register for our roadshow. We'll have a link in our email for that as well. So thank you all and have a good afternoon. Bye.
Bye, everybody.